Yeah, what kind of conditions did you see and treat there?
We saw lots of real parasites, not these supposed parasites that people are treating on TikTok these days. There was a parasite called schistosomiasis, which infects the bladder and causes blood in the urine and bladder cancer and all sorts of kidney issues as well. We actually spent a week at a leprosy colony, which was fascinating. Leprosy is actually related to tuberculosis, and it's much less contagious than tuberculosis. You really have to live in close proximity to somebody who has leprosy, and it's very, very slow growing. So I learned all about leprosy.
What is leprosy? Like, where does it come from?
It's a bacteria. So it's a bacteria like tuberculosis is a bacteria, and it is pretty unique in the way that it operates. There's a real dynamic between the organism and the body, and it doesn't really like the body temperature so much. It's a little too hot for it, and so it tends to impact the extremities more so than the central core of the body.
Right.
And so it's on people's noses and ears and fingers and toes. And it does a number of things. It destroys the nerves, and so people don't have sensation. And it also causes a degradation of the tissues, and so that they can, basically get parts that kind of fall. They're not falling off because of the infection per se, but they don't sense when they're doing damage. So that's oftentimes why they'll damage certain body parts. And the way that it manifests, it can be a loss of sensation without much deformity, or depending upon the immune response, they can have these huge lipomatous lesions. And these are kind of the pictures that we see in movies and TV where they have these gigantic growths all over their faces, and they look very disfigured and misshapen. And that is because of how their immune system is responding to the bacteria.
Right. Okay. Are there any, or just, a couple more questions about leprosy.
Sure.
Can it be cured or treated, or what do you do for it?
Yes, it can be treated by typically long-term antibiotics. Just like when somebody gets tuberculosis, oftentimes they're on multiple drug regimens, 3, 4 medications for months and months and months on end. And depending upon how far progressed people are in terms of the infection and the damage that's already done to the tissues, they can stop the further progression, but they don't always recover their sensations, or if something's happened to lose a finger or parts of the organ, like they get a saddle nose where some of the connective tissue has been lost in the nose. Yeah, so my joke was I learned how to spot leprosy from across the room by certain characteristics. Yeah,
Here.
it's a fascinating disease. And I think the thing that translates into our more modern society is that there's an interplay between all organisms and our immune systems. And this comes into play when we're talking about Lyme disease and all these other chronic infections that we can dive into if you want.
Okay, let's talk about Lyme. I guess that comes from deer ticks, supposedly.
Yeah, so I think there's a number of misconceptions that Lyme is one thing. So Lyme is technically a single organism called Borrelia burgdorferi, and it was identified in 1981 by Willy Burgdorferi, and so that's why it's called that. However, there are multiple species of Borrelia, and these Borrelia act very similarly. They look very similar. There's some genetic differences, of course, which make them as different species. But for all intents and purposes, they produce the symptoms that we call Lyme disease. And so people can have multiple different bacteria that are causing what we're, kind of generically calling Lyme disease. And that brings up a whole host of issues when we're talking about diagnoses and even potentially treatment, because there's a misunderstanding that Lyme is this one thing when it isn't. And on top of that, oftentimes the ticks that can be infected with Lyme that transmit the infection when they bite the human through the saliva, these ticks are also multiply infected by other organisms that include different bacteria, viruses, and parasites.